I came out of high school saying I wanted to be a psychologist, and I knew that would require lots of education and time, and so I was committed to it from the very beginning. But I've worked with kids as little as 3, and I've worked in geriatric population at 100. And what I found is that I've always ended up gearing towards kids because there's something about the ability to connect not only with the child and see where they are, but being able to connect with the parents and validate and understand their position while also trying to find a way to meet in the middle. Certainly being a clinician of color is important, and being able to connect and help people feel comfortable. I think that that's something that is disarming. I think I work very hard to be non-judgmental and open to everybody's perspective, and so always keeping that in the forefront and being able to help others see how that's kind of the main step in any therapeutic intervention is I'm just listening and I'm trying to adapt my approach to figure out how I can reach you. I want them to know that I'm a professional, but I'm a human. It's my goal to always be an ear, but always to be a supportive presence. So we don't have to agree, but I think we can understand that we're working towards something common and figure out how do we work together, because yeah, I can be a psychologist and make a recommendation. And if your life circumstances don't allow you to meet those needs and follow those recommendations, I don't want to hear, no, I can't do it. I want to hear why can't you do it and how I can help you get to remove some of those barriers that are in the way of you meeting your child's needs and meeting your family's needs. So at VTCC, we certainly put an emphasis on delivering trauma-informed care. And so what that means is that making sure that we're aware and understand that the majority of the population has experienced some level of trauma. We may not know it, the patient may not even know it, but research would tell us that there have been tons of instances of abuse, neglect, maltreatment that happens in a lot of people who don't even speak about it. And so if we treat every patient with the assumption that we need to be thoughtful of what could be something that's impacting you based on your history and experiences, it makes us walk differently in how we interact with you. We're really dealing with the kids and families in the highest state of distress probably they've seen in quite some time. And so not only are we dealing with the patient who may be at risk of danger to themselves, so they may be engaging in self-injury, which may be paired with depression, it may be as a result of trauma. We are seeing kids within the foster care system, but we're also seeing kids who have very early onset intense severe mental illness. So we are seeing kids as well who have psychosis, mood disorders, so bipolar disorder, depressive disorder. We do see, symptoms such as attention deficit, but usually it's related to something very functionally complex. And so my area really is around risk assessment, both for risks of self and risks to others, but also around cultural competency and fostering resilience in kids, because the ability to bounce back in the face of all these things is something that we can work to infuse more so in children. And so that's really where my work has lied. One of the key things, and I think one of the main reasons also that I value my role at VCU and at the treatment center, is the ability to be able to mentor trainees who are coming into the field of psychology. And so, yes, we're patient-facing and we're dealing with kind of crises on a daily basis, but I think for me, success is when I see that light bulb go off in a trainee's eye of, oh, therapy doesn't have to look this way. Like, I can be human. I can move around differently. I don't have to read a script in order to be helpful. And so I think success means having a student feel empowered and have a different experience, because this is hard work. And so having people feel like they're doing the best they can at what they're doing.